Hi, my name is Dr. Peter Angood. I'm the President and CEO of the American College of Physician Executives. I'm here to tell you about the Leap Ahead Award. We've had this award for a few years now, and it's part of our demonstration of the commitment we as an organization feel towards supporting improved patient safety, higher quality, and more efficient care overall. This award was developed in honor of Lucian Leape, certainly one of the grandfathers of the patient safety movement in the United States and around the world. Lucian has been kind enough to support this award and has really embodied what all of this award represents: higher safety, more quality, better efficiency. This year's award winner is Christiana Care Health System in Delaware. They have really demonstrated superbly all of what this award represents. Please join me in viewing some of the reasons why we think they are deserving.
In our residency training programs, because we have several hundred residents who touch multiple patients throughout the institution, we feel that it's very important for them to understand and have embedded in their daily work the principles of patient safety and quality. As such, we have developed a multi-pronged approach which touches almost every department in which residents are trained, to provide them with ample opportunity to understand the principles of patient safety and quality and to incorporate those principles into their daily work.
This is a really unique hospital, and what we offer the residents are some real-world training in an institution that really is trying to be ahead of the curve.
We have a graduate level interprofessional program that is required for 5 of our residency programs. It's called Achieving Competency Today. Short-term name for that is ACT, which is Issues in Healthcare Cost, Quality, Systems, and Safety.
And what I love about it, this is what I really love, is that this is not just about the residents learning from a speaker. These are residents, nurses, pharmacists, people who are all kind of early to mid-level careers, learning about the common themes in medicine.
Our ACT project was focused on really addressing handoffs within the hospital for essentially discharging a patient from the ICU to the floors that had essential key pieces of information that we felt were typically missing from some of the handoffs, at least verbally. But verbal handoffs are difficult to regulate, and so there needs to be a standardized template. That's essentially what we instituted, just the standardized template within our progress notes, so that those vital pieces of information would always be present there, despite what is present on the verbal sign-out.
So we have weekly simulation trainings. We do observations where the gaps of knowledge are, or within the team effectiveness, that team dynamic. And then we go to the sim lab. It's a very safe environment. We have the team, we create the scenarios, they do the simulation, and then we debrief them. What did you do well? What didn't go so well? How can we do better? And how do we do that the next time?
And through the VEST Center and through the simulations, we've been able to learn and practice scenarios, train ourselves for the key things that we need to look out for, so that when we implement those in the real clinical setting, we are better prepared, we're trained, and more comfortable in dealing with those scenarios more effectively.
At Christiana, in the Department of Medicine, we have a Safety and Quality Fellow, and that came about by one of these young learners, one of our residents who really wanted to spend additional time and develop expertise in leading and understanding quality and safety initiatives.
Having this 1 year gives you exposure to people who are more comfortable. They have the expertise, teach you the jargon, and be kind of let you in that first stage as becoming an expert, and hopefully make me not only more effective as a resident in process improvement projects that I work on, but hopefully more desirable as a candidate hiring-wise on the other end of my residency training as well.
At Christiana, we now offer a 2-week leadership development program for our residents, and we've gone through 1 class of that individuals. And that was a recognized need that in order to advance through the transformation in healthcare, that our residents at a very early stage of their learning career have to understand what it takes to lead an organization, what are its current day challenges, and how to think differently how we deliver care.
But what's really neat to me about here is that when they did their leadership class to try to help people develop the skills to be confident in the committee or sitting in the room, They didn't just say it's only for the chief residents. They asked for chief residents and rising leaders. And so there may have been a second year who's not going to be the chief, but who thinks they might someday want to be chief, who still got to have that same type of training and that same type of experience. And that to me is fantastic, because I actually think that physicians have to be leaders no matter whether they have an official title or not. And many times you're being called on to be a leader just by the fact that you have MD or DO after your name. And so it's fantastic that they have that opportunity, and that it doesn't just happen for certain departments, it happens across the spectrum.
Looking out for mistakes is not what we've been taught. What we've been taught is that there are systems issues, and it's important to look at the system as a whole so that we can improve it, not just for one patient, but for all the patients that come in.
It's my goal, it's my vision for each resident to have the principles of patient safety and quality so deeply embedded into the way that they provide care that they do so in an unconscious way. And that really, as they go through their careers, they are bright spots, and that others around them will acknowledge that they have special expertise and in patient safety and quality, and will actually follow their lead.